Okay, welcome everyone to this month's digital workshop, Medicare Making the Choice That's Right for You. For those of you who don't know me, my name is Desiree Hozak. I've been with the Leonard Advisory team now for 4 years, and I'm glad to be with you here today. During the workshop, Josh will be providing an overview of Medicare. I know it can be complex and very complicated, so we're here to kind of like simplify that for you and give you some information and help guide you through that. We are offering a $25 Amazon gift card. You can participate in the poll, do the survey, and sign up for a session, a Medicare planning session with Josh, and that'll give you 3 entries to win the gift card. So we encourage you to join in for that. Now, before we get started, we are required to disclose some information, so that'll come up on the screen. Okay, I know everyone read that. It's very interesting, I know, but back to this. So to summarize, Josh is a financial advisor. The Leonard Advisory Group, we're not employed by the Social Security Administration nor the federal government. We are a financial advisory practice, and we're here to help you coordinate all your financial goals and your future, your future retirement plans. So, Josh is not just a financial advisor and co-worker, he's a friend. And I've been working with him now, and I've learned so much from him. And we're kind of like, I'm his second set of eyes, and he's my second set of eyes. And I know he's here, he can help you and give you valuable information for your financial planning. And without further delay, I'll leave it off to Josh. I hope you enjoy the presentation.
All right, thanks, Des, and welcome everyone. This month, I am prepared to talk about Medicare. I got this big cup of coffee here. So although Medicare can be a bit of a dry subject, it is a critical part of your retirement plan. When we think of our health expenses overall, those can often be some of the big surprise expenses that we have that can set us off guard. I know for me personally, when Eli, our first son, was born, he was born 6 weeks early. Many of you have probably heard me tell the story of him being born, but another part of that we got was his stay in the NICU that extended over 10 days, bridged the end of 1 year and the beginning of next year. So we got one medical bill, and I paid it off promptly and thought, oh, well, that's good. I'm glad we could pay for our first son to bail him out of the hospital, so to speak. And then a couple of weeks later, I got another bill for about the same amount. So I thought, oh, must have just not got the payment yet. So I'll give it a little bit of time. And then got the bill again, second notice. So I called and they said, oh, no. This is a separate bill. So our health expenses for the birth of our first child were over $8,000. These are huge expenses, and medical coverage in retirement is critically important. As we age, we tend to have more health instances or reasons that we need to go see the doctor or that we might be in the hospital. So Medicare is a great system. The problem is it's complex, like every government system. So today, I really hope that every one of you on the webinar can at least gain a little bit more knowledge. As Des mentioned, I will be offering a Medicare planning session. So if you're about to turn 65 and worried about, transitioning to Medicare, we can help with that. If you're looking to retire in the next year, we can help you with that transition as well. If you're already on Medicare, but this raises some questions for you that maybe you should look at a different type of plan, or, just want to do a double check on what you're doing now, you can go ahead and schedule that session with me. I'd be happy to talk through any Medicare questions you have and make sure that the plan you're on is the best plan for you. So I'll jump right in. Today, we're going to cover the Medicare basics. We're going to talk about Medicare supplements, Medicare Advantage plans, prescription drug coverage, and some important dates. So we will jump right in. I'm going to start out by having a poll here. So we'll have 3 minutes to answer these questions. And the first one here is, what president signed Medicare into law? Was it choice 1, Harry S. Truman, choice 2, Lyndon B. Johnson, or 3, Franklin D. Roosevelt? Our second question here is, what year was Medicare signed into law? Was it first choice, 1948, second choice, 1957, or third choice, 1965? Let's see, we're getting some good participation here. Glad to see that. We're going to try to make this topic as exciting as possible. If anyone has questions along the way as well, please feel free to just drop them into the chat function and I'll try to answer them along the way. If not, I will follow up with you individually. Let's see. Okay. I can see 84% of people have participated, so that's pretty strong response. I still have time on my clock, so to speak here, but I'm going to go ahead and end that poll and we'll run through the correct answers here. I'm going to share the results with everyone. The correct answer to our first question, what president signed Medicare into law, was answered correctly by the majority of people. 45% got this correct. So Lyndon B. Johnson being the correct answer. And what year was it signed into law? Was actually 1965. In 1945, Truman had called for a national health care plan, but Medicare wasn't actually built out and signed into law until 1965. So thanks everyone for participating in that. And we will jump right into our material. So as I mentioned, the cost of healthcare in retirement is concerning. Healthcare overall is a $3.8 trillion price tag for our nation. So we're spending as a nation about $3.8 trillion. That was in 2019. I'll tell you, with the pandemic and everything else, that's certainly gone up. It's 5.4%. It's the projected annual growth rate is 5.4% through 2028. So we round that up and say, hey, you know what? Especially for retirees, we're going to assume that our health expenses are going to go up by about 6% a year. Healthcare premium costs can also have a big impact and a dramatic effect on retirement. If we look back to 1999, we look at overall inflation versus workers' earnings. We can see our growth in overall inflation was 45%. Workers' earnings went up 61%. But those health insurance premiums went up 255%. So our wages certainly have not kept up with the cost of health insurance premiums, nor has overall inflation. So that is a big spending piece for all of us in retirement. Seniors also tend to spend more on healthcare than the average household. So if we look at spending across all age groups in the United States, we can see typically healthcare is equating for 8.2%. The spending for those 65 and older is about 13.6%. So this is a big concern. We need to make sure that we have our healthcare spending under control. So now we enter Medicare. This program was designed to help Medicaid and Medicare together were meant to assess those entering retirement and also low-income individuals. Medicare provides the largest health insurance program offered by the U.S. government, and it currently serves over 61 million people. It's run by the CMS, or the Centers for Medicare and Medicaid Services, which is part of the Department of U.S. Health and Human Services. As many of you might know, but might also be confused by it, Medicare is divided into three parts. Parts A and B are original Medicare. Part C is Medicare Advantage, and Part D is a prescription drug coverage. So let's dig into what all those are. Part A is also known as hospital coverage. It's what's going to cover you if you go into the doctor, or it can also cover drugs that are given to you while you're in the hospital. So Part A is your hospital type insurance. This can also cover home health care and skilled nursing facilities. Part B is what's going to cover your doctor's appointments, outpatient care, or occupational and physical therapies. So these are more your doctor's appointments, A for hospital, B for doctor's appointments. Part C is going to cover everything that Medicare Parts A and B cover, and can also cover additional services, maybe like dental, vision, and wellness programs. So Part C can be used as an alternative to traditional Parts A and B. We'll talk about that a little bit more and explain how that works. Part D, this is going to be the easiest one to remember. D is for drugs. This is going to cover your prescription drugs. So One of the big Medicare decisions that you need to make when transitioning on to Medicare is, does it make the most sense for you to take original Medicare, Parts A and B, and you could choose to add on a Medicare supplement plan from a private insurance company to help cover some of the gaps in Parts A and B, and add on Part D, a standalone drug plan to help cover the cost of your drugs. Or you could take a Medicare Advantage plan or Part C. And what this does is it can roll all of those together. It can also include things like dental and vision as well. Great thing about some of these, which we'll talk about more, is sometimes they have very low monthly premiums. They tend to work a little bit more closely to what your health insurance maybe through your employer, where you have different co-pays and fees based on what doctors you go to. And sort of after you go to the doctor, you get an explanation of benefits that will explain what you owe for certain things there. So it's a little bit cheaper, but potentially you have more out-of-pocket risk there. So with original Medicare, you will pay a share of the cost. So let's look into those costs. So we can see if you file an individual tax return, if you make $88,000 or less for 2 years prior. So for 2021, these are 2019 figures. Starting in 2022, which is nearing soon, they'll bump up a little bit, but they'll be looking back to your income 2 years prior in the year 2020. So if your modified adjusted gross income was $88,000 or less, you would pay $148.50 for Part B. Let's say that your income's higher than that. Let's say you're married filing joint, your income was between $176,000 and $222,000. Well, in that case, you'd pay a little bit more. You'd pay $207,090. If you are fortunate enough that you're married and your annual income $750,000 or more, well, you're going to pay over $500 a month for Medicare Part B. Part D premiums also increase based on those income tiers as well. This is often where we see an ability for some planning as you're transitioning into retirement. If you're looking at accepting a severance package, maybe at the end of the year, like now, maybe it makes sense to ask the company to defer and pay that severance package in January of next year, thus potentially keeping you in a lower tax arena. So you might pay less in taxes and less in your Medicare premiums. So what does original Medicare cover? Part A will cover mostly your hospital stuff. So Part A, think hospital. Your Part A cost for 2021 is a $0 monthly premium, assuming you fully qualify. So as long as you paid Medicare taxes while you were working, most likely you're not going to pay any premium. Your Part A deductible is $1,484 per benefit period. Now, a benefit period, let me take off some of these numbers so it's easier to focus. A benefit period can be sort of a confusing piece here. A benefit period begins the day that you enter a hospital or skilled nursing facility, and it ends when you've been out of that facility for 60 consecutive days. So a benefit period is not a year. So in fact, you could have multiple benefit periods throughout a calendar year. So this Part A deductible, you could get hit with a couple times. So let's move on then. That's our deductible 60-day periods. We need to remember that once we leave the hospital or skilled nursing facility, we have to stay out for at least 60 days. Or if we go back in within the 60 days, we're still included in that same benefit period. After that benefit period would expire, if we went back into the hospital, we would start that deductible again. So let's talk about our hospital stay co-pays. For up to 60 days, we don't pay anything. We pay nothing out of pocket. Day 61 through day 61 through day 90, we'd pay $371 per day. Day 91 to day 150, we'd pay $702 a day, and after 150 days, we pay everything out of pocket. Skilled nursing co-pays, day 1 through 20, we don't pay anything. 21 through day 100, we pay $185.50 per day, and after 100 days, we pay 100%. So let's talk about Part B. Again, these are going to be our doctor visits for the most part. So think Part B, doctor visits. Our monthly premium here, again, it's on a sliding scale. So the average American is going to pay this lowest tier, the $148.50, but depending on your income, 2 years prior, your monthly premiums could go as high as $504.90. If you're taking Social Security, they'll be kind enough to take that out of your Social Security check for you. If you're choosing to defer your Social Security, that is perfectly fine as well. You will need to pay for that. So you'll need to set up a payment plan or just simply write a check to Medicare to cover that. So if we think of our doctor visits under Part B, easiest way to think is Medicare is like an 80-20 plan. Medicare is going to pay 80% and you pay 20%, but that's after we reach that Part B deductible. Our Part B deductible for this year is $203. So not a super high hurdle to cover. And this is per year. This is not per benefit period or per health instance or anything like that. Once we reach the $203 per year, we are done. So let's look at 2019 average out-of-pocket costs. So Medicare.gov had done a little bit of a study to look at out-of-pocket costs. Average monthly costs, so Part B premiums back in 2019 were $135.50. Inpatient care, the average person was paying $38. Outpatient prescription drugs, so what you'd pick up at the pharmacy, $328. Paying about $42 for dental services and all other health services, $111. So the average out-of-pocket monthly cost was just over $650. Let's talk about how a Medicare supplement plan can help cover some of those costs and potentially reduce your out-of-pocket costs. So what is a Medicare supplement plan? So unlike original Medicare, a supplement plan is offered through a private insurance company. So this is not through the federal government. Insurance companies are required to offer the same basic benefits based on the letter of the plan. So we are super fortunate that we decided to also use our ABCs for the supplement plans, as well as the original parts of Medicare. So we have lots of ABCs, so we'll help clear that up here a little bit too. But our supplement plans are also going to be lettered plans. Depending on that letter, we get different benefits or different abilities to cover the gaps in coverage. They do help cover co-pays, co-insurance, and your yearly deductibles. So let's take a look at that. Here is the whole swath of plans. So we start out with a plan A. So A, B, and D, great. We already have other A, B, and Ds that we need to deal with. So that makes it really complicated, but they cover different parts of the gaps in Medicare Part A and B. I'm going to make it real simple here. Plan G and Plan N are the most common plans that we see. They tend to be the most robust as well for those entering retirement now. So let's look at that Plan G. Plan G, if we look, it's going to cover your co-insurance and hospital costs up to 100%. It's going to cover your Part B co-insurance or co-payments up to 100%. It'll cover the first 3 pints of blood. It'll cover hospice care, skilled nursing facility, and your Part A deductible. So if we think about those hospital stays, if we had a couple hospital stays broken up by 60-day periods or 61-day periods, we would have all of that covered with the Plan G supplement plan. Any Part B excess charges. So in the state of Pennsylvania, it's currently illegal for a healthcare provider to charge excess charges if they accept original Medicare. That's not true in every state. So let's say that you spend the winter in Florida. In Florida, doctors can charge above the going Medicare rate. This plan would help cover within those limits. So if they charge 115% of the accepted Medicare expense, this Plan G would help cover that gap in coverage. If you have a foreign travel emergency, it'll cover up to 80% of that as well. Then we have our Plan N. So if we look at Plan N, everything appears to be the same here, except these Part B excess charges. I'm going to also direct you to all these asterisks that also says, hey, Plan N also requires a $20 copayment for doctor's visits and a $50 copay for emergency room visits. So you will have a little bit more out of pocket. And if you are traveling and maybe visiting doctors in other states, you wouldn't be covered for those excess charges as well. So Plan G will tend to be a little bit more expensive than Plan N, but that's because you get a little bit more coverage. So those are supplement plans. So let's kind of look now, going back to this chart of our expenses of how this would cover. So let's add a supplement plan G in. Again, we're going to eliminate that Part A deductible. We are also going to eliminate our hospital stay out-of-pocket costs. After 150 days, though, we would still incur a fee there. So it's up to the limit. We're not going to pay that $742 a day. If we're in a skilled nursing facility, it'll pay the $185.50 per day. It will also cover that 20% of our Part B. So if we think of Part B, going to the doctor, 80/20 plan, we are going to only pay that $203 deductible for the year. So that makes our health expenses quite predictable in retirement. So let's take a look at those numbers in action. We have a 65-year-old male with Plan G coverage. Plan G covers all expenses except the Part B deductible, in this case of $203. Our Part A deductible of $1,484, Part B co-payments, 20% billed, 15, et cetera, et cetera. So what have we cut down by reducing these expenses? Total out-of-pocket costs using the supplement plan is now down to $268.50 versus $655 a month like we previously went through. This is assuming a non-tobacco user, and the monthly premium for this Plan G that we ran is about $120. So certainly a huge way to reduce those medical expenses in retirement. Helps cover you for unexpected expenses. So if you end up going into the hospital, maybe there's a medical emergency, it helps reduce those out-of-pocket costs for you. I am going to send out a real quick link here too. I meant to do this a little bit earlier. I am offering those Medicare planning sessions. So I know I just went through a lot. We'll take a quick breather here. I just sent a link out to everyone. If you already say, hey, Josh, you know what? I hear you. Medicare is complex. I think I need to reassess it. Just go ahead and click on that link and schedule. It's a half an hour planning session with me. We can go through your individual details. For anyone that signs up for that too, I'll send you a helpful guide that we put together that overviews a lot of the material that we're going through. So let's continue on now. How a Medicare Advantage plan helps overall Medicare costs. So now we're not talking about a supplement plan, we're talking about an Advantage plan. So a little bit different here. Let's take a look. What's a Medicare Advantage plan? So unlike original Medicare, this again is offered through private insurance companies. Benefits from the Medicare Advantage plan can really be all over the map. Typically, what we tend to see is that we have low monthly premiums, but things are not covered quite as robust as through the supplement plans. So you may still be responsible for co-payments, co-insurance. You'll still have yearly deductibles, out-of-pocket costs. And many times you have to work on staying inside a network, and you may be limited to certain doctors or hospitals, and those can change within the plan as well. So we're going to call Medicare Advantage our option 2. So option 1 would be taking original Medicare Parts A and B. You can choose then to add on a supplement plan if you want to or not. You're not forced to do so. So Medicare Advantage plan, we're going to say is this option 2. This is going to combine Part A and B into one plan. It typically, but it doesn't have to, will cover a drug plan as well. And sometimes they'll throw in dental and vision plans there as well. Here's sort of a side-by-side comparison so you can get a little bit better of an idea of how these can work. So our Medicare supplement plan, we are going to have a monthly premium. The Medicare Advantage plan, it says low. So typically they tend to be a lower monthly premium than a supplement plan. Includes Part D, dental and vision. Medicare supplement plans will not. Medicare Advantage plans usually do. Will a Medicare supplement plan provide co-payments to providers? No, a Medicare Advantage plan typically will. Will you have up to $10,000 of out-of-pocket costs? No, with a supplement plan, but yes, with an Advantage plan. So again, so far, just kind of recapping these details, the Advantage plan tend to have lower monthly premiums, but potentially way higher out-of-pocket costs. Go down so restricted to a network of doctors and hospitals. When we went through our recent healthcare reform, although not so recent anymore, aka Obamacare, that was a big thing in selling that plan to the American people that, hey, you can keep your doctors. I got a question from Harry. I thought Medicare Advantage plans are zero premiums. They certainly can be zero premiums. So we say low because they tend to be lower than a supplement plan, Harry, but they don't have to be zero. Many, especially in the Pittsburgh market that are heavily advertised, can come with a $0 monthly premium. So that is correct, but it would depend on the individual plan. So kind of going back here, restricted network of doctors and hospitals, we can potentially have that through an Advantage plan. We would not through a supplement plan. So if that choice of doctors is a top priority to you, or you're afraid that maybe a doctor that you've had a great relationship with might be dropped off of the plan, the supplement plan might be a better route for you as well. You are also able to appeal coverage decisions to Medicare. Through the supplement plan, you are not through an Advantage. Again, I just noted, can my doctor be dropped? Not through the supplement plan, yes, through the Advantage plan. Can my plan be canceled? You can cancel a Medicare Advantage plan. So maybe you get set up with a plan that you really like, and the insurer decides that it's really not profitable in the marketplace. So they may pull that plan from the marketplace. You could actually have that plan canceled. So not only lose a doctor off the plan, but you could just lose the plan as a whole. Do you have the ability to travel the country and use any doctor or hospital? Yes, through the supplement plan. No, through the Advantage plan, although there can be some exceptions. The Medicare Advantage plans can be built to be a little bit more travelable, but that'll depend on the individual plan. So let's look at choosing a plan that's right for you. I'll drop that link out in the chat again to everyone that we see up here. But again, my goal with this webinar today is to provide you guys with some helpful information so you can learn a little bit more about the Medicare system. It is a complex system, so we are certainly here to help. I encourage you to schedule that 15-minute session. A 30-minute session. There is no fee for that. It's complimentary. So, you guys can ask me whatever you want. At that time, you're under no obligation to us. If it seems like we'd have a good opportunity to work together, of course, we'd be happy to do that. I'm going to throw up our next knowledge check here. This is going to kind of recap some of the information that we've covered thus far. So looking at this, in Medicare Part A, how long is a benefit period? Choice 1, 60 days. Choice 2, from the day you enter the hospital or skilled nursing facility until you have been out for 60 consecutive days. Or choice 3, from the day you enter a hospital or skilled nursing facility until the end of the calendar year. This is partially a quiz for me to make sure I'm conveying information correctly to you guys as well. So I see we have a couple of respondents. The second question up here in this poll or knowledge check is, what is the difference between Medicare Supplement Plan G and Choice 1? Plan N is like Plan G, but requires you to pay $20 copay for the doctor and $50 for the emergency room. Or 2, Plan N is hospital insurance and Plan G is for doctor visits. Or Choice 3, Plan G offers the least amount of coverage and N offers the most. I see we have about 30% that have participated. Give you guys a little bit more time here. Okay, we're jumping up here. Again, anyone that's participating in these polls too, that's another entry to win the $25 gift card. So I encourage you to participate. Also helps break up the presentation, more fun for you guys as well. So we're up to 70% now. Give you guys a little bit longer here. All right, it seems like we've leveled off with no more participation. So I'm going to go ahead and end the poll here. I will share those results with you folks. Okay, Medicare Part A, how long is the benefit period? 89% of this got this answer correctly. So thank you. I'm glad you guys were listening, and it appears as if I made it quite clear. So it's a little bit confusing. Many times people think, oh, it's based on the calendar year. A benefit period is how long our deductible stands for. So it's from the day you enter the hospital or skilled nursing facility until you've been out for at least 60 days. So 60 consecutive days. So let's say 30 days in, you go back into the hospital. That will extend that benefit period. Question number 2, what is the difference between Medicare Supplement Plan G and Plan N? Plan N is like Plan G, but you have a copay. You also $20 copay for the doctor, $50 copay for the emergency room. I can also, so I got a question from Harry here as well. Anyone that wants a copy of this presentation, I can make it available in PDF form to people. So if you just let me know via the chat or shoot me a message after, or if you schedule that planning session and say, hey, can I have those slides too so I can prepare, just let me know and I'll email those out to you. So yes, Harry, I can certainly send. Going back, so Plan N versus Plan G. The other big difference there is that we also have those excess premiums. So again, if you travel to Florida, you might have to pay extra above the stated Medicare price. So that would be another difference between those two plans. Everyone got that one right. So that's great. Glad you guys are learning something here, or you already know it. Let's move on to Part D now. So Part D is an optional prescription drug benefit program. This is to help reduce your out-of-pocket costs for prescription drugs. So we all know as we get older, we tend to start taking more prescriptions. And, I remember for myself as a kid sitting down to eat breakfast with my grandmother, and she had one of those big, medication things where on each day she's supposed to take all of these medications. And I was sort of amazed. What are all of those? Why do you have to take all of them? Well, that's sort of the reality of life. And also it can be a blessing as well, as it can help keep us healthy and able-bodied for a longer period of time, but they don't come free. So Part D is our drug coverage in retirement, and it is it's required to cover some basic benefits offered by Medicare. So again, these are more templated. They have minimums, but each plan can differ a little bit as well. So you usually choose Part D in one of two ways. So you can choose it as a standalone insurance plan to buy those drugs. So let's say that you've chosen to do Parts A, B, and add on a supplement plan, but you have some concerns with your drug costs, you would want to add on Part D or a drug plan as well. If you're doing a Medicare Advantage plan, it can often be included in there. It doesn't have to be, but many times it is. So Part D would be included in that Medicare Advantage plan. Those are the two ways we can access it. I'm not going to go through all these numbers. This is going to get a little bit too detailed. If you have concerns about your drugs, we'll run through some individual plans with you. But in the interest of time, I have committed to be done in 5 more minutes. We're going to cover a lot more. So your prescription drug plan, again, the important thing to remember with this is if you are concerned about your drug costs in retirement, you will want to get a prescription drug plan coverage or Part D. If you are not taking on that drug plan coverage, it can hurt you, as if you don't file for that initially, you will pay a penalty if you try to add it on later. So, let's get a plan that's cheap for you. I believe in the Pittsburgh market, there are plans that are as low as $10 a month. So even if you don't have a lot of prescription drugs that you're taking now, you will want to jump onto that. So who's eligible? At age 65, you're eligible for Parts A and B, even if you're still working. You may be eligible through Medicare through your spouse, although you must still qualify by age or disability. So if you haven't worked, but you've been married, you would still qualify through your spouse. And if you have a disability, you might be able to qualify earlier. You will have automatic enrollment in Parts A and Part B. If you're receiving Social Security benefits, your initial enrollment period package will be mailed 3 months before you're turning 65, and that will give you your Medicare card as well. If you are not already getting Social Security, you will have what's called your initial enrollment period. That's 3 months prior to the month that you turn age 65, the month you turn age 65, and 3 months after that. So it's a 7-month window. If you retire after age 65, enrollment depends upon whether your employer sponsored coverage ends. So when that coverage ends, you will be eligible at that point. Or if you have a disability or you're newly qualified for a disability, that will open your IEP or initial enrollment period. Your Medicare supplement enrollment periods. There's open enrollment period, which starts the month your Medicare Part B is effective and lasts for 6 months. In that open enrollment period, you are guaranteed issue regardless of health status. I'm going to repeat that one again. You are guaranteed issued regardless of your health status. This is really important, especially if you're entering retirement with some pre-existing conditions. You are guaranteed that coverage. So that might be a wonderful way to help manage your retirement healthcare costs if you're concerned about your health. Get in that open enrollment period where you're guaranteed issued by the most robust plan, and that'll help you control your healthcare costs. You can also have a special enrollment period. So these are guaranteed issued, right? Or another qualifying circumstance. So sometimes if a plan drops to you or something like that. In an outside enrollment period, this is when you must go through medical underwriting. So there is no guaranteed issue from the insurance company at that point. So if we just decide to switch plans, potentially could have it underwritten based on our health conditions. Now, if you're perfectly healthy, that certainly is not an issue whatsoever. Go through it and you can switch to a more robust plan. Like if you're on an Advantage plan, you want to switch to a supplement plan, you can do that. If you do have pre-existing health conditions, it becomes even more important when you first go on Medicare to make sure that you're making a well-informed decision to cover your conditions as much as possible. Here are some important dates. So right now we are in what's called the AEP, or annual election period. That started on October 15th and goes through December 7th. So if you've seen a million commercials on TV, that's why. If you're of age, I'm sure you've gotten a million things in the mail as well. And that's also why I do this presentation this time of the year. It's top of mind for a lot of people at this point of the year. So during our AEP, this is AEP for Medicare Advantage plans and prescription drug plans for the next calendar year. So now you have the ability to shop out your Advantage plan or look for that for a drug plan that might better cover the drugs that you're taking. So every year it's kind of good to say, hey, you know what, maybe your medications have changed. Maybe you're now taking different drugs than you were the year before. Is there a better drug plan to help control those costs? Now, any of these plans, if we switch to them, they will not be effective until January 1st. Another important date, January 1st through March 31st. This is annual disenrollment period if you're choosing to return to original Medicare. So let's say that you had went on to an Advantage plan, but you've opted now to go back to original Medicare, probably in hopes of adding an Advantage plan and trying to get a little bit more covered. January 1st through March 31st would be that annual disenrollment period. Other helpful resources. So Medicare.gov is one of the best government websites for consumers. It gives you endless information. Many of the things that I pull when I'm putting together presentations, we simply go to Medicare.gov and pull that information. You can actually shop plans on, you can look at drug plans, you can do all kinds of different things there. There's a couple helpful guides, the Medicare and You Handbook. This is published annually and it is released each fall. This is a good overview to help you gain a better understanding of Medicare. Choosing a Medigap policy, a guide to health insurance for people with Medicare. Again, great way to help you learn a little bit more. As I mentioned previously, anyone that has concerns or questions about what we've covered today, I encourage you to schedule that Medicare planning session. I've allotted 30-minute slots in my calendar to help cover those. When you schedule that, I'll send out this guide that we put together, Understanding Medicare, Know Your Options and Costs. It provides a pretty good overview covering a lot of the material that we went through in the webinar today. So I encourage you, if you haven't already, I know a couple people have said in chat that they've already scheduled. great. If you haven't already, I very much encourage you to schedule a time. There's no obligation there. To be quite honest, Medicare is something that we've added on to our practice to help with our existing clients. We are not trying to fight everyone to get them to move their Medicare plans with us. We're happy to help our clients and help educate the public on that. So this 30-minute session is really just to see if you need to reevaluate your choices or answer any questions that you have. I hope everyone has enjoyed the presentation today. If anyone has questions following up from this or at this point, feel free to throw them in chat. I will respond and go back through that chat thread and send out emails to anyone that had additional questions or concerns, or for those of you that requested the slides, I can send those along to you as well. So I thank you everyone for participating today. I know Medicare is not the most exciting thing to talk about, and I assume that there's more exciting things for you to do, but I certainly applaud you for taking the time to learn a little bit more, to help educate yourself and hopefully make your retirement more enjoyable by controlling some of those health costs. So thank you all for joining. Next month, we'll be doing another webinar. We're going to do a tax planning webinar for next month, so keep an eye out for that invitation. We'll be talking about some of the proposed tax law changes, maybe something will get signed into law as well, or we might be a little bit closer there. So keep an eye out for that. Of course, that's something that's on the top of everyone's mind. So we'll try to dispel some of the myths, talk about what some of the proposals might mean, or if we have a law, we'll go through that updated information as well. So keep an eye out for that invitation. Wrapping up for the year, we're going to do a special webinar about ESG investing. So if you're looking to learn a little bit more about ESG investing, we'll have a guest from Morningstar on that webinar as well. So keep an eye out for that invite as well. And I hope you all have a wonderful day. Thanks for joining.